Okay, well, hello everyone, and thank you so much for joining. I'm really excited to share this information with you today. So my goal here is that anyone who has or knows somebody with cancer can actually come away from this talk with some evidence-based knowledge that's going to support you in your immune system and healing cancer. And I also want to talk a little bit about some cutting-edge immune cell therapies that we're actually currently using to treat cancer. And I hope to keep the level simple enough that people without a medical background can actually understand, but also with lots of new information that also physicians in the audience will gain from this talk. So I'm just going to, okay. So my name is Minako Abe, and I am the Vice President of the Tokyo Cancer Clinic. I'm actually US board certified in emergency medicine and lifestyle medicine, which seems like a bit of a jump. I did practice emergency medicine for 15 years in New York City, and I loved working in the ER. I just loved it. But after a while, I realized that 80% of the patients that were coming in through my doors were coming in for potentially preventable conditions. You know, whether it was trauma related, drug and alcohol related, infectious diseases, heart diseases, diabetes, like a lot of these things we can prevent. So I realized, you know, we really have to start upstream, which is what brought me and made me interested in lifestyle medicine. Even 40% of cancers has been found to be preventable. So about 9 years ago, I had the fortunate opportunity to return to Tokyo, where I grew up as a child, and work with my father at the Tokyo Cancer Clinic. So here is where I really learned about oncology, about immune cell therapy. I did a lot of research, and I'm really passionate about bringing this information to people because it's largely unknown outside of Japan. And a little bit after I moved to Japan, I actually had my own personal scare with my husband, who was diagnosed with an extremely rare spinal cord tumor. And so, of course, I freaked out and I reached out to my colleagues in the States and I said, okay, where should I take him so that he can get the best care? And to my surprise, the neurosurgeons that I reached out to said, no, stay where you are, actually, because where you are, they have, you know, new technologies, new treatments that, you know, don't exist anywhere else in the world. So we stayed in Japan and he got excellent care and he's doing great. But so because of this, I really became very interested in sharing some of the treatments that we have here. So I'm excited to do that as well. And, you know, if you're here, you know, chances are you know somebody with cancer or you might have experienced it yourself. And it's no surprise because the lifetime chance of getting cancer is 1 in 2 for men and 1 in 3 for women. And it's actually getting worse and worse. You'd think that the statistics were getting better, but they're not. People are getting sicker and diagnosed earlier, right? And how can this be the case, right? We've all been told that cancers are, you know, a genetic condition, but it turns out only 5 to 10% of cancers are actually inherited. It's found that 30 to 50% are preventable. And the other half, it's, you know, things that we largely can or cannot control, but things like, you know, toxins, infections, inflammation, a lot of it has to do with our lifestyle, and some of it is just bad luck. Right. So I guess what I want to say is that, you know, it's not your fault. You can do everything right and still end up with cancer, or you could be a drinker and smoker all your life and not get cancer. But if you think about it, right, we as human beings, we are just made up of trillions of cells. And every day these cells are being bombarded by various things, whether it's UV radiation, pollution, inflammation, infections. And then, of course, there are things that we can control. We know that alcohol and smoking are carcinogens. A lot of ultra-processed foods can be really bad for you, even obesity. It's considered that 40% of cancers in the US right now are directly related to obesity and being overweight, which is a scary statistic. Of course, you may have inherited these oncogenes, these tumor cancer genes. And then just in our everyday lives, right? We have these trillions of cells in our bodies, and old ones are being replaced by new ones. And, errors happen, mistakes can happen. So it's considered that there are up to 5,000 genetic and epigenetic changes that occur in our cells with the potential to turn into cancer every single day, right? So if this is the case, why don't we all get cancer, right? We probably are walking around with a few cancerous or, potentially cancerous cells in our bodies right now, but our cells do have mechanisms to be able to repair our DNA. And we have our immune system. Our immune cells go around and circulate our body and patrol our body. And when it finds precancerous and cancerous cells, it actually finds them and kills them, right? So cancer, as we know it, occurs really when these damaged cells, they start to grow and divide and spread out of control instead of self-destructing as they should, right? So it's really important to keep our immune system super, super healthy. So how does lifestyle play into this, right? I'm a lifestyle medicine doctor. So, this is really big. We actually have a lot of agency into our medical conditions, right? So, we all know that tobacco and alcohol, right, can cause cancer, but equally important are things that we do in our everyday lives, right? How well we eat, how well we sleep, our day-to-day exercise, and stress relief, right? And stress relief sounds strange because it seems like this a very non-specific thing, but how we handle stress can directly impact our health. And also in this, I include things like human connection, which I'll talk about later, is very important. So, you might have a genetic predisposition to some of these illnesses, but whether or not these genes are expressed largely has to do with our lifestyle. You might have two identical twins, right? They both have the exact same genome, the same genes, but one might get cancer and one might not, right? And we know all of this has to do with our lifestyle. So I like to break down sort of our different lifestyle factors very simply: eat, sleep, move, and relax. So I'm going to go through each of these and talk about how we can use these things in order to achieve an anti-cancer lifestyle. So I'm going to start with eat. So the number one thing that you can do in your diet to have an anti-cancer lifestyle is to unprocess your food, right? There was this huge study that showed that a 10% increase in processed foods actually leads to a 12% increase in getting cancer. Yeah, that's huge. So, what is processed food, and, why is it so bad for us? So food should look like something that our great-great-grandparents would look at and recognize as food, not some sort of boxed, packaged food-like substance, right? It should look like it did as it came out in nature. And that's because processing food was designed for a long shelf life, which is fine. It has its role, but in doing so, it strips out a lot of the nutrients, a lot of the fiber out of it, just so that it lasts on the shelf. And, why is this really important? Well, we get our nutrition, obviously, from food, and also fiber. Why fiber? Right? Because fiber is not a macronutrient. We don't get any sort of nutrition from fiber, but fiber will feed our gut bacteria, right? And why is that important? Well, your gut microbiome influences your immune system, and it influences cancer. 70% of our immune system lies in our gut. And how healthy, how well balanced our gut bacteria is actually directly determines a response to our cancer therapy. So this is a really cool study that shows how your microbiome influences cancer and cancer treatments. In the study, they followed a bunch of patients with non-small cell lung cancer, and they measured their gut bacteria doing fecal testing. And they found that if you had too little or too much of a particular bacteria called Akkermansia muciniphila, if you had too little or too much, your immune system didn't activate when you were given this immune checkpoint inhibitor drug. It's a type of cancer drug. So your immune system didn't activate, and the treatment essentially didn't work. Your tumor stayed large. But if they took these individuals and changed their gut bacteria by dietary intervention, by giving them probiotics or prebiotics, or even using fecal transplants, right, where you actually take healthy gut bacteria from another individual, a donor, and transplant it into the patient so that their gut bacteria balance is better, then they found then their immune system did activate, the drugs did work, and the tumor shrunk. So it sounds crazy, but your gut bacteria directly impacts your immune system and impacts whether or not some of these immune treatments, whether or not they'll work. So what are the best cancer-fighting foods? These are my top 4. So number 1, cruciferous vegetables. So these are, your broccoli, your cauliflower, your kale, your cabbages, Brussels sprouts, kohlrabi. These types of vegetables, not only do they have a lot of fiber in them, they have something called sulforaphane. And sulforaphane is a compound that directly prevents the development and the progression of cancer. So that's number 1. Number 2 are stone fruits. So these are your apples, your pears, your peaches, your plums. These fruits, they contain a substance that directly inhibits a hormone called VEGF. VEGF stands for vascular endothelial growth factor. So for a tumor to grow from just like a little, few millimeters to a large cancer that's going to cause problems, it needs to grow blood vessels to it, right, to feed the tumor. So by inhibiting the VEGF, you're actually inhibiting the growth of the blood vessels to the tumor. So number 3 are berries. These dark purple, red, blue, beautiful berries, right? These berries not only contain a lot of fiber, but they also have something called polyphenols in them. So polyphenols and antioxidants, they're anti-inflammatory. And these berries, the substances in these berries actually help to cause cell cycle arrest. And it causes the cell cycle to stop and for abnormal cells to go into something called apoptosis, which is basically cell death. So that's why these berries are really important. And these polyphenols also show to increase that Akkermansia muciniphila, that gut bacteria that I talked about in the last slide. So berries are very important. And then number 4 are the alliums. So the alliums are a family of the onions, the garlics, the leeks, the shallots. So how when you cut into an onion and your eyes start stinging and watering? Well, these are due to the organosulfur compounds in the onions. And these also inhibit cell mutations and it inhibits tumor growth. So those are my top 4 cancer-fighting foods. Also, in order to maintain a good microbiome, you want to increase fermented foods in your diet, such as, pickles, kimchi, sauerkraut, natto, yogurt, kefir. These types of foods have lots of probiotics in them and also help your microbiome and your immune system. So these are the good cancer-fighting foods. What are the foods that we want to limit? Right, so we already talked about the ultra-processed foods, right? Because they have all the fiber stripped out of it, a lot of their nutrients stripped out of it, a lot of additives, lots of salts, fats, sugars added to these foods. So we want to limit that. Also, we want to limit processed red meats and red meats, right? Processed meats, so your sausages, bacons, hams, those actually are known to be carcinogenic. They're classified as a class 1 carcinogen. So you really should limit them to, very, very few times. And then red meat, all right? Red meat is less of a strongly associated carcinogen. It's a class 2A carcinogen, which means there is an association, especially with colorectal cancers. But the limitation is a little bit less. The current limit, they say, is 500 grams per week, which is quite a lot, actually, if you think about it, right? The palm of your hand, this is about 100 grams. So that 5 times a week doesn't seem too much of a limitation for me, but, obviously, less can be more. So, and then number 3 is alcohol, right? Alcohol is also a class 1 carcinogen. The current recommendations on that is that there's no amount that is a safe amount. And if you are not a drinker, you probably shouldn't start. But, for those that do drink, they say that 2 drinks a day for a man and 1 drink a day for a woman is the upper limit. And the reason for that is alcohol gets metabolized into acetaldehyde, which is a known carcinogen. And especially people with, Asian descent, if you drink and you tend to flush and get that red flushing reaction, it's because you are lacking in an enzyme to metabolize. And so in those cases, you should really try to minimize the alcohol. And then finally, excess sugars. Right? A lot of added sugars and particularly sugar-sweetened drinks are not good for cancer. So we know that cancer thrives on excess glucose. So if you think about a PET scan, right? What is a PET scan? It's a CAT scan that people will get to, look for cancers. And what they do is they take glucose and they radioactively label them, infuse them into your body, and then you go in the CAT scanner. And then what happens is where your cancer cells, your cancer cells are very metabolically active and they prefer glucose, straight glucose for their fuel for the most part. So where those cancer cells are gobbling up that radio labeled glucose, that's what lights up on your PET scan, on your CAT scan. So, we really should minimize excess sugars. I'm not saying zero because our body makes sugar because we need it for energy. But when you are making too much sugar, not only is your glucose level elevated, what happens is then your body reacts by increasing insulin and increasing insulin-like growth factors. And both of these are growth factors for cancer. So we want to minimize, if possible, a lot of excess sugar. Okay, so that is eat and nutrition for an anti-cancer lifestyle. Next, I'm moving into something that's very important also for cancer. And it might be a little bit counterintuitive, but it's sleep. And sleep is really important, especially in activating your immune system. And there is a sleep and a cancer connection. They've found that men with insomnia actually have double the risk of developing prostate cancer. People who have less than 6 hours a night of sleep generally tend to have a 50% increased risk of colorectal cancer. And postmenopausal women who sleep fewer hours have a higher likelihood of getting aggressive breast cancers and have a higher chance of recurrence. So much so that the IARC, which is a division of the World Health Organization, do consider night shift work a group 2A carcinogen. So like red meat, it's not a huge association, but there is an association. And they tested this in night shift workers, particularly women, female nurses. They found that for every 5 years of night shift work, their risk of breast cancer increases by over 3%. And they've also found that male night shift workers have much higher rates of prostate cancer, bowel cancer, lung cancer, and bladder cancer. So how does that work? Right? So it really impacts your immune system. And you might have heard, well, if you're really underslept, then you're set up for getting a cold. And they actually found this to be true, right? This was kind of a crazy study where they took a whole bunch of healthy volunteers, brought them into a hotel, and they quarantined each one of them. And then they actually inoculated each one. They actually squirted rhinovirus, the virus that gives somebody the common cold, into each of these healthy volunteers' noses. And then they quarantine them to see what happens. And it turns out that if you get plenty of sleep, So individuals that got 7 or more hours of sleep, hardly any of them actually got sick. Only about 17% of them got sick. But they found out that with each subsequent hour that they didn't sleep, their risks of getting the cold were higher. So much so that if you got 5 or less hours of sleep, then almost half of them ended up getting the cold. How does this happen, right? And what's happening during sleep that is so important for your immune system? And what they've found is there are a number of really important immune cells. One is called the dendritic cell that I'm going to talk about a little bit more later. And the dendritic cell is kind of like the commander-in-chief cell. It's the one that recognizes cells that are infected or cells that are cancerous, and it actually gets activated and increases in number while you are sleeping. Right? And also natural killer cells. This is the other type of really important immune cell when it comes to cancer. And both of these cells increase in number and get activated while you're sleeping. They took a bunch of healthy volunteers and who normally get 7 hours of sleep, and just for one night, they decreased their sleep to 5 hours. Just this one night of decreased sleep actually reduced their natural killer cell activity by 72%. So that's pretty crazy, right? We really, really need to value our sleep. So that's sleep. Next, I'm moving on to move, to exercise. So how does exercise impact cancer? Well, exercise is actually one of the most powerful things that you can do to prevent cancer, to improve your treatment outcomes for cancer, and also to avoid a recurrence of cancer. And so, everybody wants to know, well, how much is enough, right? Can you over-exercise or under-exercise? It turns out there is a sweet spot. People who are training for marathons, often their immune system will get a little bit suppressed. But most of us, the problem is that we're not getting enough exercise. So the sweet spot is really about 150 minutes of moderate intensity exercise a week. 150 minutes might sound like a lot, but if you break it down, it's really just 30 minutes a day, 5 days a week. Right. So I think that most of us can find time during our day to get that much exercise because it doesn't have to be all at once. You can actually do this in 10-minute chunks, like a 10-minute brisk walk in the morning, in the evening, and during your lunch break, and you've had your exercise for the day. And what I mean by moderate intensity, it doesn't mean having to go to the gym and doing a real tough workout where you're huffing and puffing and sweating. Moderate intensity means at a level that you can still carry on a conversation. So it might be too intense to be, walking fast and singing at the top of your lungs. But if you're able to carry on a conversation, that is considered moderate intensity exercise. So how does exercise actually help your immune system? Well, when you're untrained, then a lot of times we have this sort of metabolic disturbance, a low-grade inflammation. And when you have, inflammation is a good thing, right? If you have this gash in your arm, you want a little bit of inflammation there for your immune cells to go there and make sure you don't get an infection, right? But if you have this low-grade inflammation, let's say in your gut from not eating well, what happens is your immune system is kind of distracted and it can't go to the places that it needs to go to keep us healthy. And it's found that when you have this low-grade inflammation and your immune system is not working very well, you're much more likely to miss, your immune systems are likely to miss getting to these, early stage cancers, and you're more likely to get a metastasis if you have a primary cancer. And what happens when you exercise, right? The physical effects, the endocrine effects that occur, it increases your immune system, it activates your immune system, and your natural killer cells that can kill cancer cells can actually infiltrate and get to the cancer much more readily. And they found in studies that it actually can reduce the chances of metastasis. And then when you're trained, right, do you exercise regularly? You're in much better metabolic health. Not only is your circulation better, right, then your immune system is kind of primed and ready to go and act where it needs to go. And they found that people who actually regularly exercise have a decreased risk of getting cancer, right? And it also increases the efficacy of the different different treatments that you're undergoing, whether it's chemotherapy, radiation therapy, or immunotherapy. And it also reduces the side effects of the various treatments that you have. So, and it also helps to prevent the cancer metastasis and relapse. And this has been best studied, I think, in breast cancer. And they found that women who actually exercise have a 30 to 40% lower risk of getting breast cancer. And women who continue to exercise after their diagnosis, they are much less likely to die from their breast cancer, right? The 64% lower mortality. And even if you've never been an exerciser, right? Women who started exercising for the very first time after being diagnosed actually had a 45% lower mortality rate. So super important to exercise. If you're a survivor, exercise reduced your breast cancer recurrence by 40 to 50%. And overall, exercise just not only just improves your immune system, it is so good for your mental health and just for your quality of life. So exercise is an excellent thing to do for your health. So finally, I'm going to move on into the relaxation, right? How does relaxation, and I'm going to talk about human connection also in this category, how does that help us have an anti-cancer lifestyle, right? So the stress response. So again, stress is not necessarily a bad thing, right? We evolved with this stress response in order to be able to survive. So as we evolved, right, there were times that we had to run away from predators or fight against predators, and we needed this fight or flight response, right, in order to get our heart rate pumping, our breathing, our blood pressure going, so that we could fight or flight against our predators. We also had this surge of blood sugar into our system to use as energy, right? And, it's possible that you could get injured or get bitten by a lion. So we wanted our immune system primed to be able to take care of that. So that's a good thing, right? But this is kind of a one and done sort of fight or flight stress response. In today's world, we're not being chased by lions, right? But we are stressed out, right? We're stressed out by things that are chronic. So whether it's work stress, relationship stress, we're being bombarded by emails and messages and, illness. Illness itself is a big stressor, right? And it's not a one and done thing. But to our bodies, right, the stress response is governed by the same hormones, the same stress hormones, whether or not it is a lion that's chasing us or whether it's chronic stress. And so what happens when you have this chronic stress and our stress hormones are elevated for a long time, right? This blood pressure that was elevated so that we had, the energy to run away. When it's chronically elevated, right, this sets us up to get hypertension, elevated blood pressure. Just think about that word for a second, hypertension, right? So elevated stress for a long time increases your blood pressure. Right, the blood sugar that we needed for our energy, when that's elevated for a long time, right, not only is your glucose elevated, your insulin, right, is released in response to elevated blood sugar. And when both are elevated for a long time, you become a setup for type 2 diabetes, right? The inflammation that's going on in your body, right, that has been correlated with heart disease and Alzheimer's disease, and also cancer. So we don't want to have this chronic stress ruling our lives, right? So you can't say that stress directly causes cancer, okay? But we know that stress impacts our immune function. So like with the lion, right, that is attacking us, we do see that our immune functioning goes up temporarily, but when the duration of the stressor is prolonged, moderately to chronic stress, our immune system can't keep up, and it actually just really starts to take. And we do know that chronic stress decreases our immune function. It decreases our T cell numbers. These are our fighting, T cells. It decreases their activation and also decreases the number of your natural killer cells and decreases their activation. We know that high levels of stress hormones for a long time, it actually increases DNA damage. It makes our DNA more fragile. It also can impair our repair mechanisms. So it's harder to fix our damaged DNA. and it also increases our overall cancer risk, right? We also know that chronic stress for a long time does increase cancer metastasis. And most of these were done on animal models where they showed that an animal, when you stress them out, it actually makes their cancer more aggressive. It increases their cancer progression and also makes them more likely to end up having metastasis. Right. So what does human connection have to do with stress? Well, humans are social beings, right? We evolved by relying on one another to survive. So actually, having this lack of social connection and this feeling of loneliness in particular causes, enormous stress. And I think this is why the pandemic was so hard on most of us. So you can't say that stress directly causes cancer, but there is an association. And people who report that they feel lonely, actually men, that actually increased the risk of prostate cancer by about 10%. And the higher the psychological stress, the higher rates of cancer mortality were seen, right? But on the flip side, cancer survival actually improves with having perceived a large social network by 20%. That's pretty huge. And people who feel that they have a high level of social support actually improves their survival by 25%. So it's not this ephemeral sort of thing, stress and loneliness. It feels like it's something that's hard to put your finger on, but it actually does have a huge impact on our health. Okay, so we've got our, what governs our stress levels, right? Our fight or flight sympathetic response, right? That increases our heart rate, respiration, blood pressure, and blood sugar. So that's governed by our stress hormones, our norepinephrine, epinephrine, cortisol, and growth hormones, right? And what balances that out is our parasympathetic hormones. So you've got your fight or flight hormones, and then you've got your sort of rest and digest hormones. And those are our dopamine, our oxytocin, our serotonin, our endorphin, our sort of happy hormones. And that balances it out, right? It decreases our heart rate, our respiration, blood pressure, blood sugar, inflammation to sort of balance ourselves out. So how do we tap into these happiness hormones, right? Just like our stress response is governed by hormones, our relaxation and our feelings of happiness can also be governed by hormones, right? So our dopamine, our oxytocin, endorphins, and serotonin. So our dopamine, right? Dopamine is our reward chemical, right? And there are healthy ways of getting this and unhealthy ways of getting this, right? So we want to stick to the healthier ways of getting our dopamine. So dopamine, our reward chemical, right? We secrete dopamine in our bodies from task completion, like checking off a checklist, right? This releases dopamine and makes us happy. Celebrating wins, right? That makes us happy and it releases dopamine. Listening to music, meditating, and getting quality sleep. These are all things that will increase our dopamine levels. And then oxytocin. Oxytocin is our love hormone. We secrete this from, human connection, holding hands, getting a hug, getting compliments, singing, and playing with babies or pets, and actually releases our love hormone, the oxytocin. Our endorphins, right, our painkillers. Endorphins are released with exercise, right, singing and dancing, eating dark chocolate in moderation, having sex, and laughter, right? These things will release our endorphins or our painkillers. And then we've got our serotonins, our mood stabilizers, right? So serotonin is released with sunlight, with aerobic exercise, being out in nature, tryptophan by certain foods, and eating prebiotic and probiotic foods. All right. So Okay, so we can get these in, healthy ways. And, human connection is super, super important. We want to strengthen. Hang on. Okay. Okay. So human connections definitely are important, right? We want to strengthen, existing relationships that we have. We can through human connections, joining a class or a club, volunteering, showing kindness, being attentive and present, being curious. All of these things will help to increase our human connections and also strengthen these connections and increase our sort of happiness hormones that will help out. Hang on one second. I just want to make sure that I'm on the right list. Yeah, we're okay. Okay, I apologize. So basically, are there other ways to further increase our, immune cells? Like, how do we increase our immune cells? How do we sort of empower ourselves with our lifestyles and also, using other methods in order to sort of fight cancer? So, we have certain things, with immune cell therapy that actually can also help to fight cancer. Our natural killer cells and our dendritic cells. These things basically will help to further increase our cancer fighting ability. So I'm going to talk a little bit about that. And so, generally when we want to heal cancer, right? So this big, ugly red blob is our cancer. And all of these lifestyle things that we're doing, what it's doing is it's activating our immune system against cancer. So what happens is we have, these immune cells that I talked about, the dendritic cells, the T cells, and they fight against our cancer. So what happens is, it recognizes these different various things and will pick up these recognizes these cancers, and then it activates our immune system to fight against the cancers. So let's say this ugly blob right here is our cancer, and it has these little markers all on these cancers. And our immune cell has the ability to recognize that, and then it activates our immune cascade. So these are the dendritic cells. And what they do is they can actually recognize these tumor antigens and then take them back and sort of start this cascade of our immune cell army, and it activates our T cells and activates our immune cell army to be able to come back and recognize these tumor cells. So remember this image because I'll come back to it. So these are our dendritic cells, right? And they instruct our T cells. And so you can see that these dendritic cells, they have these little tentacles that reach out. Dendritic means tree branch-like, and they are searching for tumor antigens, and they process it so that they can train our immune system to attack the cancers. Right? So these are the T cells, and here you see the dendritic cell coming, with these arms that reach out. And they're touching these T cells and giving them the instructions and saying, these are the cells, these are the targets that you're looking for. So what we actually can do clinically is we can create a cancer vaccine using these dendritic cells. So if you look on the surface of a cancer cell, we have all of these tumor markers, and you might have heard of some of these, like CEA, HER2, CA125, right? So these are markers that are on our cells. These are tumor antigens. And what we want to do is train our immune system to recognize these as, a cancer cell so that our immune system can actually attack them. So let's say you have, patient A and patient B, and they could have the very same cancer, but their tumor profile is very different. So we check each person's tumor markers, and we can actually create a cancer vaccine using these dendritic cells. So let's say patient A has elevated CEA, elevated PSA. So we create a cancer vaccine using their dendritic cells in order to target their own tumor. So patient B might have the very same cancer, but her tumor profile is very different. So we would create a cancer vaccine using her tumor profile, with elevated CA125 and other things. So we actually create a target using their dendritic cells. We create a cancer vaccine. So the other key cell in this is the natural killer cell. So here we see this is a cancer cell, right? And these little cells that are attacking it are called natural killer cells. So here we see these little natural killer cells attacking, and then you see this cancer cell just implode on itself. How cool is that? So here we see what happens, right? This is a little experiment that we did in our lab. We took a bunch of breast cancer cells and we added natural killer cells that we grew out from our own cells in the lab, and we added them to this breast cancer. And you can see within 5 hours of adding the natural killer cells go and start to destroy the breast cancer cells. And our bodies do this naturally all the time. We're just enhancing these effects by turning them into a treatment. Right? And why do you need both? Why can't you use just one or the other? Well, our cancer cells are pretty clever, right? And not every single cancer cell will have these little tumor markers on the surface. So, our T cells and our dendritic cells, they won't all recognize every single cell, because some of these tumor cells will actually evolve to hide their tumor markers. So that's why you need both. The natural killer cell will attack the tumors that are actually hiding their tumor markers, and the dendritic cells and the T cells will actually be able to target the ones that are expressing these vaccines. So you can see, cancers as they spread, they will actually change a little bit, and some will be expressing their little tumor markers on the surface, and those are the ones that the vaccine, the dendritic cell vaccine, and the T cells can target. And the ones who are hiding their tumor markers, and that happens more and more as cancers evolve and metastasize. Those are the ones that are targeted by the natural killer cells. So that's why we have this two-pronged approach, using two types of cells to target the tumors. Okay, so this is my lab in Tokyo, actually, and in Japan, regenerative medicine is approved under the Regenerative Medicine Act by the Ministry of Health. So we take our own immune cells and we take them in the lab and we multiply them to the millions into the billions. And we use this by returning it to our bodies to work as a cancer vaccine. And we infuse these natural killer cells to target and kill our own cancers in our bodies. And because they're your own cells, the side effects are really minimal. So this is our treatment protocol. We actually take a patient, we take their blood, and we separate their immune cells from their blood draw, right? We can separate them into, dendritic cells are very few in the body, right? We have to use precursors. Dendritic cells are only 0.4% of our white blood cells in our body. So in order to amplify them, we actually create them in our lab by taking their monocytes, growing the monocytes into the billions, and then we transfer and we turn them into dendritic cells. And then from there, we can actually pulse them with cancer antigens. So if a person has, elevated CEA or elevated HER2, we can actually take their dendritic cells and add these tumor markers to them. And what happens is they will actually incorporate them and then express them on their surface. And in doing so, we can actually create a cancer vaccine, right? An individualized cancer vaccine for that person. What we can also do is actually, if they have a fresh sample of their tumor, we can actually extract those surface proteins and actually use that as a tumor target as well. So that is our cancer vaccine. And then from the same blood draw, we only need about 25 milliliters of blood in order to do this. And this is part of our patented procedure, where we take their blood draw and we separate their natural killer cells out, and we proliferate and grow out these natural killer cells. Those are the ones, the little ones that were attacking that cancer cell in the middle, right? And we can activate and proliferate them to the millions and to the billions, and we also administer them through an IV. So basically, this technology is available to a degree in the United States as well. There's a treatment called Provenge for prostate cancer, which is similar to the dendritic cell vaccine. But in order to get the numbers needed for this treatment, they actually have to do an apheresis, which is kind of like a dialysis treatment, where you have to have your whole blood circulate through a machine in order to collect enough cells to do this. So we actually have a patented procedure to do this. Okay, so it takes 2 weeks to create these cell treatments that we can administer for treatment. And we repeat this process 5 times, and that's considered 1 round of therapy. So I'm just going to give you a few case studies that we have done. This was done in a lady who was 89 years old, and she had a left-sided lung cancer. This is the left side of her lung, which she actually underwent chemotherapy and radiotherapy and got better, but unfortunately the tumor recurred on the right side of her lung. And this is a PET scan. Remember I talked about how when you eat glucose, right, that a PET scan, when you add radiolabeled glucose through an IV and send them through a CAT scanner, then where the tumor cells are gobbling up that radiolabeled glucose, that's what lights up. So that's what you're seeing here. So this is the lady's tumor right here. And then they underwent the dendritic cell vaccine and natural killer cell vaccine. And 3 months later, when she repeated the CAT scan, this is a regular CAT scan, not a PET scan, you can see that her tumor has actually disappeared. She didn't want to undergo, severe treatment, because she said, well, I'm 89 years old. It's like, I really want to have a treatment that is not going to impact my lifestyle too much. So, and then this patient, he's a 64-year-old gentleman with gastric cancer, and I'm, sorry about the graphicness of these photos. This is a view from an endoscopy, so a flexible camera that goes into his stomach. And what you're seeing here, this is a large tumor, his stomach cancer, and this is his CAT scan. So it takes a slice through his belly, and this whole thickened portion right here is the gastric tumor. So, he wanted to do everything, and he, started some oral chemotherapy, and, he went to his surgeon and said, can't you just cut it out? But the surgeon was like, no, it's, too large, there's no point in cutting out. So he came to us, and we started his dendritic cell vaccine and his natural killer cell therapy. And through this, actually, you can see that after 3 months, this large tumor shrunk down to this small nub in here. You can see it on the top and on the bottom. And then after this, he went back to his oncologic surgeon, and they said, okay, well, we can actually try and get rid of this now. And he actually went to surgery and did very, very well. So, how efficacious is this? Cancer is a very tricky disease, and we want everybody to have the best outcome possible. So we try and work with their primary oncologist. So this statistic is not just the immune cell therapy, it is combined therapies. But most of our patients are, stage 3 and stage 4, because they've tried all the other therapies and they didn't work. So they come to us sort of as a last resort. And in our patient population, they got a complete response in about 7% of the patients. So that means the tumor completely disappeared. 25% of our patients had a partial response. So that means their tumor shrank by at least 30%. 41% had stable disease. So that means that the tumor did not get larger and they did not get smaller. They remained stable. And then unfortunately, about 27% of our patients had progressive disease. So we consider this about a 73% cancer control rate. So, improvement or stability in 73% of our patients who we did this treatment with. All right, so we really want to use all the tools that we can against cancer, including the surgery, the chemotherapy, the radiation, but also there's so much that we can do, for ourselves, right? We really have a lot of agency in what we can control, including how we eat, how we sleep, how we move, and how we can relax in order to strengthen our immune system against cancer, right? And we can also use our immune cell therapy using the dendritic cell vaccine that I showed you, and also using natural killer cells in order to have this multifaceted approach in order to achieve the best outcomes for our patients. Okay. So I'm going to end this talk with this little cartoon. I had Pedromics, I got their permission to use it. So this is the cute little dendritic cell with its arms all outstretched, presenting an antigen, right, to our immune cell army, the T cell. All right, it comes from the Sistine Chapel with, this being the God cell, giving the instructions to the T cells to say, go forth and multiply and go and attack those cancer cells. So thank you very much for your attention. With remaining 5 minutes or so, I'm happy to take any questions.